Welcome you all. A nice warm welcome on a cool evening. Welcome to the U.S. 32nd Congressional District Candidate Debate on Healthcare. Tonight, I will ask 5 questions, and each candidate will have 2 minutes to answer. So no candidate has an unfair advantage. By always answering the question first, I will rotate the order of the responses from the candidates. Their answers will be timed by the ladies here in front, and I ask the candidates to observe a 2-minute limit to be fair to all the other candidates. At the end of the question, each candidate will have 5 minutes to offer their summary or concluding remarks, and after which members of the audience will pass among you to hand out cards like this where you can write questions you would like to ask of the candidates. Any particular candidate or of them all? Now, let's meet the candidates for the United States Congressional District 32. On my right, Seth Hollis, Libertarian Party. On his right, Catherine McGovern, Democratic Party. And on her right is someone who's substituting for Pete Sessions, Republican Party. Now, there's someone so that you will know who he is really. It's Bob Franklin. He's professor of government, University of Texas, Dallas. So, let me begin with the first question. And I'll begin with Seth Hollis. Are you in favor of privatizing Medicare, and why?
So, I would say yes. I understand there's a lot of people who rely on it today. I certainly wouldn't want to cut them off short. My parents included are relying on Medicaid, or Medicare, and my brother as well on Medicaid. What I think we need to do is find ways to phase it out. It's a quarter of the national budget today. It is potentially $100 trillion liability over the next few decades. It simply is something that we as a nation cannot afford. How do you phase it out? Well, and it's kind of like the idea of Social Security. When it was originally implemented, it was expected to help a small number of people who really needed some help. Today, it's expanded to where we have almost half the people in the nation who are relying on social services or expecting them when they retire. We need to change that mentality. We need people that are going to be more self-sufficient, more willing to take care of themselves. We're not going to solve the problems of this nation by having us all rely on the government. We're going to solve it by having us rely on ourselves and finding solutions for ourselves.
I'll ask the same question of Mr. Sessions. Are you in favor of privatizing Medicare, and why?
Well, as you know, first of all, I'm not really Pete Sessions. Feel free to boo at any point. Everyone knows that the Republican Party has always stood for privatizing because we know from experience that private industry can always do it better. We've seen it with Blackwater. We've seen it with privatization of prisons and foster care here in Texas. We always know that if there's profit to be made, those private companies will figure out a way to make those profits. I am completely in favor of privatization of everything so that those who run these organizations can make a nice, substantial, healthy profit, keep that profit, not pay it in taxes, and let that trickle down to everybody at the bottom. So yes, the Republican stance is we believe in privatization of everything, including health care.
Thank you. Now, to continue with the questions on health care, this is to Ms. McGovern. Do you favor a voucher plan for Medicare, and why?
I would like to have an opportunity to answer the first question, if you don't mind.
I think that's a good response. Ms. McGovern, are you in favor of privatizing Medicare, and why?
I am not in favor of privatizing Medicare. Medicare exists since 1965, and those persons who are enjoying the results of their having paid into Medicare until they were 65 or reached that time are people who have a contract with this country. We cannot just, by saying we don't want to abide by the contract that each and every one of these Americans have engaged in for all these years, because suddenly we decide it's not something that we want to do. Medicare is extremely important to everyone who is over 65 or 65 and over. I can recall when Medicare first came into existence in 1965. Before that, we did not have a safety net for health for our older Americans. And there were many older Americans who were left destitute because they used all their savings to pay for Medicare. That's not the kind of country that I want. I think that if there is a problem with Medicare, that we should consider alternative ways of funding it, and that is the way that we should go. I think that what the President is doing in terms of trying to have a more efficient, value-based service of medical needs to Medicare recipients and beneficiaries is the way to go. We can be more efficient. It may be that as time goes on, we will decide that the amount that each person contributes with each pay period needs to be increased, but certainly not change it.
Thank you very much. To continue, Ms. McGovern, do you favor a voucher plan for Medicare, and why?
I do not favor a voucher plan for Medicare because it cannot possibly work. It's made on the concept of the government issuing a certain amount of money. I've heard as low as $1,500 to everyone over 65 to use to purchase their health insurance. I think anyone who has health insurance, or whether you have health insurance or not, has gone to receive any sort of medical service knows that that's abysmally ineffective. Also, it doesn't take into the account the benefit of having people share in the expense of their health care as they age. By continuing with the approach that we have, the Medicare, which has been bought by the beneficiaries, should continue to provide services to the beneficiaries.
Thank you. All right. Mr. Hollis, do you favor a voucher plan for Medicare, and why?
Well, I think it's hard to answer that question because anytime you start talking about vouchers, there are so many different definitions of what a voucher is, how you implement it, what does it really mean. As I stated before, I think the real solution here is not to turn it to vouchers, not to privatize it, but to phase it out.
Thank you, Mr. Hollis. Congressman Sessions, do you favor a voucher plan, and why?
Yes, I do favor a voucher plan, and here's my reasoning. It'll put a cap on the actual expense, because what we will do is give individuals a voucher for a fixed amount of money. Probably not going to be enough money, but if you're wealthy, you can supplement that with your own income and get the care that you want. And if you're not wealthy, you don't have anything that you can supplement it with, so you just hope that you choose your doctors wisely and that it's going to be enough for whatever type of an illness you might develop.
Thank you, Congressman Sessions. to continue, Congressman, on July 11, you voted for and the House passed House H.R. 6079, which would repeal the Affordable Care Act. Congressman, how would you ensure that senior citizens receive the preventive care, prescription drug savings, and consumer protections they receive today with the Affordable Care Act?
Well, I can actually quote right off of my website here. Obviously, healthcare has been a great issue of importance to me, and Americans have some of the greatest healthcare in the world. And one of my priorities is that all Americans have access to that. The problem with Obamacare, according to my website, is that it is plagued with new mandates on individuals and businesses. It increases taxes for everybody. It reduces Medicare benefits, and it's the largest government intrusion in the doctor-patient relation, the relationship ever seen before, with the exception of women's reproductive health. But the Republican Party and my stance is that the Obamacare is not the solution for Americans. Americans should just live healthier lifestyles, keep their covenant with God. God will protect them from getting sick, and you do not need to have medical insurance paid for by the United States government.
Okay. Ms. McGovern, inasmuch as you did not have the opportunity to vote for H.R. 6097, but you may in the future, would you act to repeal or keep the Affordable Care Act?
I would vote to keep the Affordable Care Act. I think it's one of the most outstanding pieces of legislation that we have seen in many years because of the fact that it gives all Americans an opportunity to have health insurance, and it protects Americans in many different ways, including the free preventive care for both children and adults. More than in this particular district, it's almost 120,000 people who have benefited since 2010's passage of the Act. I also think that the Act saves the government a lot of money over time, and that's confirmed by the CBO's estimates with respect to the amount of money that's being saved. One of the false notions that has been floated is that somehow in Medicare, the Affordable Care Act is taking huge sums of money from Medicare. But that is not accurate. It is true that because of the savings on Medicare through not paying for duplicative services and other ways, there is a great deal of money that is being saved that is protecting against waste, fraud, and abuse. But all the money that's being saved is going back into the Medicare program, and so it is not being lost to the citizens who are the beneficiaries of Medicare. I think also that the Affordable Care Act provides us with the greatest safety as consumers because we are able to enjoy the rate restriction rule, that is the 80-20 that all insured people have. That is that your premium, 80% of your premium has to be devoted to your health care. And if it's not, then it is rebated to you, or if you have your health care through an employer, to your employer.
Thank you, Ms. McGovern. Mr. Haltz, if you were elected to Congress, would you act to repeal or to keep the Affordable Care Act, and why?
Absolutely, I would. And I'd also add to that that would not do anything to prevent senior citizens and others who currently receive Medicare from receiving those benefits. All it would do is bring us back to that Medicare system that we're on. The whole point to this Affordable Care Act was really the idea that Medicare is going to bankrupt our country. They needed to do something, and all they did with this act was take Medicare and the funding that's in it and move it over to another government program. they didn't fix the underlying problem. The underlying problem stems from 1971. Nixon and Kessler, I think is how you say it, came up with the HMO system. This idea that somehow our insurance company can get involved in our healthcare decisions to make things more affordable or to make things better for us has backfired on us. And it's continuing to backfire on us. This Affordable Health Care Act is not going to do anything to fix that. It's going to continue to backfire on us, make things more expensive. One of the things I would really like to do, as I mentioned, I have my parents on Medicare, I have a brother who's on Medicaid. I would love to be able to cover them under my health insurance, but I can't because they're not my dependents. Why should that matter? Well, according to government regulations, it does matter. I would like to be able to see an expansion of healthcare savings accounts. This Healthcare Affordability Act does not expand them. It limits them further, which I think is a step in the wrong direction.
Thank you, Mr. Holtz. Ms. McGovern, to continue, do you favor Medicare negotiating the prices it pays for prescription medicines?
Yes, I do. I believe that the beneficiaries of Medicare would be profoundly benefited if they were able to have the same price basis as has been negotiated for the veterans of our military. There is no reason in a government program such as Medicare that we should not be getting the best price possible for not only the pharmaceuticals that beneficiaries use, but also the medical devices. Right now, we have many people who are suffering quite dramatically because of the cost of the prescription drugs that they have. And this has to stop. We have to have all of our seniors who are receiving prescriptions be able to pay for them and have those covered through Medicare, and the way that we can do that is through the bargaining for the price. Thank you.
Thank you, Ms. McGovern. Pete Sessions, Congressman Sessions, do you favor Medicare negotiating the prices it pays for prescription medications?
I don't believe that the United States government can effectively negotiate anything, that it should be left to private enterprise to negotiate. The negotiating tactic that the United States government would use would be to essentially regulate prescription medication costs, and by regulating them, you would be undermining pharmaceutical companies' reason for making a profit and spending money on developing new drugs. I think that negotiations should be done by the private insurance companies and not by the United States government.
Thank you, Congressman. Mr. Hollis, do you favor Medicare negotiating the prices it pays for prescription medications?
What I favor is us as individuals being able to negotiate the price we pay for our prescriptions. The problem with prescription, the cost of prescription, is this whole idea of government regulation. We put in all these government regulations and government mandates to try and limit these costs, but they actually don't do that. They do the exact opposite. Medicare prescription drug plan is one of the reasons why prescription drugs are actually getting more expensive, not cheaper. In fact, I would even go so far as to say that there are other things affecting our health care, affecting the way we manage our own health care, keeping us from being responsible for our own health care, that cause us to start using these medications that honestly we don't need. There are better solutions out there, but because of FDA regulations, because of the USDA and other government regulations, these things are looked down on. They're thought of as quackery, when in fact the simple matter is if we would eat better, take care of ourselves, we wouldn't need a fraction of the medications that America is taking today. It's caused by what a lot of people today call crony capitalism, or corporatism is probably more accurate. This idea of you've got pharmaceutical company executives with a revolving door into the FDA and back again that are promoting their drugs, promoting their solutions to healthcare, when their solutions to healthcare don't actually fix the problem. They're just there to drag people along to make money.
Thank you, Mr. Hollis. Congressman Sessions. Should private insurance companies continue receiving overpayments with taxpayer dollars for Medicare Advantage when that is, when Medicare Advantage is more costly but no better than traditional Medicare?
I would disagree with the premise that that insurance companies are being overpaid. But if the insurance companies are being overpaid, that will be that money would be used to provide greater benefits for all of the beneficiaries of our insurance policies. Therefore, I would limit the ability to audit the government and how these expenditures are made. That private enterprise should be left alone. The United States government should just pay. If they're obligated contractually, they should just pay the premiums. And if the insurance companies are overpaid, they're there to make a profit. That's their purpose.
Thank you, Congressman. Mr. Hollis, should private insurance companies continue receiving overpayments with taxpayer dollars for Medicare Advantage when they are more costly but no better than ordinary Medicare?
I think this is a perfect example of how a government entity causes prices to go up. Give you an analogy. If we bought our cars the same way we buy our health care, we wouldn't buy them at all. They'd be provided to us. Our work would give it to us. We'd pay for gas, we'd pay for the occasional maintenance, but for the most part, that car would be given to us as a perk, as part of our job. Well, what happens when we lose our job? What happens when we retire? Well, now we got to say, well, the government's got to give us a car. Inevitably, these cars would become more expensive. We wouldn't be driving around old cars. We wouldn't be driving around inexpensive Civics and Accords. We would be driving Cadillacs and Lexuses because we're not paying for it. Someone else is. We don't care how much it costs. If we took healthcare back to our responsibility to where we pay for it, get our employers to pay into a healthcare savings account so that we can then from there buy our own health insurance, decide how to spend that money on our healthcare. Now the prices have a real market pressure to come down. And you don't have this problem that you have anymore with Medicare and with government plans. Government pays for half of the medical coverage out there today, and that's why it's so expensive. Instead of us, the people, taking responsibility for ourselves and doing what's best for us, giving it that market pressure, which will inevitably bring the prices down.
Thank you, Mr. Hollis. Ms. McGovern, should private insurance companies continue receiving overpayments with taxpayer dollars for Medicare Advantage when they are more costly but no better than traditional Medicare?
No. One of the things about the Affordable Care Act, which I consider quite positive, is the emphasis on encouraging providers, be they hospitals or doctors or pharmaceuticals, whatever, that there is an efficiency, a cost efficiency that is associated with it so that you avoid having the over-treatment. Now, with the Medicare Advantage situation, because of the way that it is built out, it's built out per service, there is an incentive to those who are providing medical services to beneficiaries who have Medicare Advantage to charge more because of the way that the reimbursement system is set up. In contrast with Medicare, you have a flat fee. The Cleveland Clinic has recently completed a study in which they have grouped or teamed the medical services that are provided to the beneficiaries who come into the Cleveland Clinic for any kind of medical service. And as a result, it has brought, two things have occurred. The effect of the medical service provided has been better for the patient. The patients are not returning to the hospital as frequently as when there is not that team approach. Also, the medications which are provided, because there is a team approach, the risk of having a conflicting outcome because of a drug interaction is mitigated because of a team working together. The Affordable Care Act has moved in that direction and is continuing to do so. I believe it is that structure which will bring down the cost of services, and that the Medicare Advantage approach does not really help at all.
Thank you, Ms. McGovern. Now, because the questions are over, maybe you have some questions. And if you have one of these cards, or if you would like to have one, and write a question. Okay. Please hold them up, and they will be collected. Yes.
Should the questions be limited to healthcare? Can they be other issues?
I think because this was communicated as being directed to healthcare, we'll limit it to that. Now, each candidate will have 5 minutes for a concluding statement on, and I'd like to begin at the end of the table with the our congressional representative, Mr. Pete Sessions.
It has long been my goal to provide the best American health system available. I don't think that the government should be involved in it. I think that consumers are better able to choose the medical coverage that is correct for them. Contrary to what my opponent has said, my staff assures me that the Congressional Budget Office says that the new health care law would actually add to the federal deficit. How that is, I'm not quite sure, but my staff has said it, so I believe it. The problem with Obamacare is fewer choices, higher healthcare costs, unsustainable Medicare, and government interference in the physician-patient relationship. That interference in the physician-patient relationship is unprecedented, with the possible exception of the government getting involved in women's reproductive rights. That's okay for the United States government to get involved in that. But other than that, it's not the domain of the United States government to get involved in issues of public health care. This is a privilege, it's not a right. If you worked hard and you saved money, and you put that money away into private health accounts, you're going to be covered when the time comes. If you live at the low end of the socioeconomic scale and were unable to put away that money to cover yourself, well, you should have just worked harder. Thank you.
Thank you, Congressman Sessions. Ms. McGovern, you have 5 minutes.
The Affordable Care Act is the act which provides the best opportunity for this nation to do two things which I consider extremely important. One, to ensure that all people have an opportunity to receive the medical services that they need, that you do not have to go bankrupt to have services, that your choices are not between taking the prescribed medicine for a medical condition or having your dinner. I think that these things we have to move away from. The Affordable Care Act also is working to bring us into having a more cost-efficient manner of providing medical services, and also encouraging the providers to work together to have a outcome that is beneficiary to the patient as well as to provide them with a fair recovery or a fair payment for their services. I do not agree with those who wish to reduce arbitrarily the cost of services that medical providers charge, but I do believe that we have to have a basis for why. I saw a report not too long ago. An appendix in one appendicitis or an appendectomy in one hospital might cost $1,800 and another it costs $200,000. It's not clear why there would be such a discrepancy between such a similar medical procedure. I believe that the medical costs are going to come down, and the cost to the government, as the CBO has demonstrated, will be reduced. These are all reasons, just as an economic basis, to want to have the Affordable Care Act continued. More than that, we've had the experience as a nation of not having medical services reasonably available to all people. That put us in a very difficult position, and having observed what happened in the early 60s and before that, where if you did not have some form of health care, if you were not fortunate enough to have been able to save up the amount of money necessary to cover yourself, you would end up with having nothing and being without medical treatment. That's not the America that I believe in. And I do believe that we are moving in the right direction. It's not my view that the Affordable Care Act is perfect. I don't think it is. But I do think that it is a structure that we have in place that we can build on, we can amend as necessary, and we should move forward to providing a comprehensive health care service to our citizens and to those who are here and covered by the Affordable Care Act. And I therefore support it and urge that those members of Congress who have misguidingly voted to repeal it not do so. I'm hoping that the current representative from Texas for this district will not be able to do so, because I will be representing this district. For this reason, I urge, and these are things that we have to look at for what is the best thing for all of the people in this district. It is not what's best for the few, it is what's best for all of the people in this district. That's what I think we should do with health care. Thank you.
Thank you, Ms. McGovern. Mr. Hollis.
I think we've been having the wrong conversation for decades now. The real problem is not health care. We have health care in this country. We have very good health care in this country. We have some of the best technology in this country. Some of it's very expensive, and sometimes not justifiably so. If we had real market pressures in this country to keep those things more affordable, I think we would still have very good healthcare in this country. We have some of the greatest minds in the world in this country over the last half a century that have come up with some great innovative new technologies. To think that somehow that happened because of Medicare or Medicaid or other government programs, I think is disingenuous to the people who came up with those technologies. The real problem we have in our country, and it's been around for probably since the 70s, since the HMOs were created, is that we have insurance in the way. We have insurance dictating what our doctor can and cannot do. I've got a very good friend that I talked to recently. He's a general practitioner, family practitioner here in Garland, and he expressed to me that he cannot talk to his patients about certain healthcare related issues that he would like to be able to talk to them about. The reason he can't do it is because they're looked down on. Nutrition. He can't talk to them about nutrition, about exercise. He doesn't get paid for that. What he gets paid for is writing prescriptions, because that's what his health care or the health insurance companies say that he gets paid for. And again, this goes back to this corporatism. Pharmaceutical companies who want to sell their product. They've been wanting to do it since the early 1900s when the Rockefeller Foundation was formed and encouraged schools, medical schools, to teach that form of medical practice. Why did they do that? Well, because the Rockefellers had a shell company that owned a lot of pharmaceutical companies. And of course, they had controlled the Rockefeller Foundation, which then gave grants to these schools in exchange for teaching their form of medicine. There is a much wider view of medicine out there than what we're being allowed to see. And that is why our healthcare costs are going up, skyrocketing, because you want to cut our medical care costs by 80% in this nation within just a few years. I can tell you how to do it. Get the USDA to stop selling us the food we should eat based on whose agricultural business they're trying to promote. Have them actually tell us what foods are actually good for us. 80% of the medical costs in this country are for chronic diseases. The vast majority of those are because we are malnutritioned. We don't eat the right kinds of foods. You change all of that dynamic by getting government out of the way, getting regulations out of the way, and giving people the ability to make decisions on their own, to do the research on their own, give them the incentive to be responsible for themselves, be responsible for their own health care, be responsible for the way that they are treating their own bodies. Not the government, not the corporations. This is about personal responsibility. This is not about government. That is a conversation we need to be having.
Thank you, Mr. Hollis. Looking at the questions, I see that we can expand the framework of questions but still keep it related to health care. For example, the first question I have in front of me is the United States is $16 trillion in debt, and the budget is a joke. How can we continue to subsidize Medicare and medical entitlements when we are approaching financial collapse? Why don't I start with Mr. Congressman Sessions?
The continuation of the Medicare program is essentially to provide health care for the elderly. As a result of some of this health care, we are keeping people alive longer than they should be. This is costing the United States government and the taxpayers a huge amount of money by spending limited amounts of money that we have, prolonging the life of the elderly. And if the United States government got out of the Medicare business and let nature take its course, the cost savings would help us reduce the budget of the United States and go a long way to cutting the deficit of the United States. So the United States government should get out of the healthcare business completely.
Thank you, Congressman. Ms. McGovern, would you like me to repeat the question?
I would, thank you.
Okay. The United States is $16 trillion in debt, and the budget is a joke. How can we continue to subsidize Medicare and medical entitlements when we are approaching financial collapse?
I do not agree with the premise that we are approaching financial collapse. Our country has more than $64 trillion in assets, and so by any standard, we're not on the brink. However, we do need to responsibly deal with our deficit. The deficit is entirely different than the federal budget, which, insofar as the questioner may have been referring to the Ryan budget, also known as the Romney-Ryan budget, as a joke, I would agree, because that budget will lead us into further deficit as compared to not, and it also unreasonably harms those who can least afford to be harmed while protecting the interest of those who have a very substantial wealth base. I'm not against people being wealthy. I think that's comes from good work most of the time and also from other sources. However, when we're talking about the federal government, we have to be talking about the interest of all of the people of the United States. We cannot just simply say, we're not going to care anymore for those in our country who are needy or who are on the lower part of the income level, and we can't say that we, in my view, are going to allow an economic chasm to continue. I think that what we have to do is look at the tax code to stop the tax code spending that we are engaged in. I believe that the Affordable Care Act has been proven to reduce the deficit as we continue forward and to be good for the budget.
Thank you, Ms. McGovern. Mr. Hollis, would you like me to?
No. The real problem with the budget is that we haven't had one in 3.5 years. Senate has refused to pass a budget in 3.5 years. What we really need to do is cut everything, including Medicare, Medicaid, Social Security, defense spending, and a number of other unconstitutional bureaucracies that our government is promoting and paying for. We need to cut everything by at least 40%. That's how much we are spending above and beyond the revenues that the governor's bringing in. And that's just the starting point. That $16 trillion is going to bankrupt our nation because of interest rates. Right now they're low. They're not going to stay low forever. When they go up, that interest alone on that debt is going to go up, and it's going to consume a much larger portion of our national budget. How well are you going to be able to pay for Medicare then? You're not. We either cut back drastically now, or we lose those social services completely, and the people who are relying on them today lose them completely. The bigger reason, though, that we are in danger of reaching a financial crisis or a budgeting crisis with our federal government is because there are so many baby boomers today that are retiring. They're going to start expecting Social Security checks. They're going to start expecting to be covered by Medicare. That's $100 trillion worth of unfunded liabilities that we have in our nation coming up in just the next few decades. That is the real financial crisis that we're facing. And if we don't change the conversation and get people thinking about what they can do for themselves rather than what can the government do for me, until we change that mindset, there's not a whole lot we can do to change our financial problems that are looming over us.
Thank you, Mr. Hollis. There were a couple of questions here. I'm going to merge because they ask essentially the same question. Would you back, and why don't I start with Mr. Hollis and go to Ms. McGovern and then Congressman Sessions. We come this way, we'll go right back. Would you back a centralized healthcare system such as those in Canada and some Asian countries, where you can get the benefits that wealthier Americans receive today? The second part of that is, would you support a single-payer system, which is essentially the same thing as the centralized healthcare system?
A single-payer system or a centralized healthcare system is a government-mandated monopoly. Now, I think we all know, back in the early 1900s, how well the monopolies served this country. They are a threat to our personal liberty and our safety. So no, I would not support either of these things. I think the real answer, as I've said before, is more personal responsibility, less government involvement, less government intrusions on our lives.
Thank you, Mr. Hollis. Ms. McGovern, would you like to repeat the question?
I understand it. The question is essentially, should the Affordable Care Act have been a single-payer act? And The answer is we didn't have the votes at that time to pass it. I don't know whether or not the nation is agreed enough to have a single-payer system. I think that it is the way that we should probably consider going because it's going to ultimately be less expensive for us in the long term. The reason it would be less expensive to us is that the people would have, first of all, a lot of the preventive care, which is provided for in the Affordable Care Act. There's a lot of talk by Congressman Sessions and by Mr. Hollister about personal responsibility. I think it's important to remember that the Social Security funds and the Medicare funds are insurance contracts that have been entered into by the beneficiaries, everybody who works in this country and receives any form of a paycheck, even if they are self-employed, are to be paying into the Social Security or the Medicare fund. I realize that some people do not, but by the same token, that is their obligation. When we talk about personal responsibility, I believe that really goes to the burden, if any, but also the honesty of our own members of Congress to recognize that everyone who is receiving these benefits receive them because they have paid for them. And I think that that is something that is lost by the use of the word entitlements. As an attorney, I understand that if you're talking about a contract and you're talking about being paid through that contract, that's an entitlement that you have as a matter of law because that's the deal that you worked. What I hear and what disturbs me is the idea that we should forget all the money that has been paid in. Now, there's a lot of talk about the baby boomers, and I hear the number of 70 million a year turning 65 and becoming. The red sign came up. Thank you.
Thank you, Ms. McGovern. Congressman Sessions, would you support a centralized health care system or a single-payer system, and why not?
I do not support any type of a centralized system. I think that the government should stay out of this. It's up to individuals. The single-payer plan would be a disaster because it disincentivizes the providers of medical care to compete and try and keep our costs low. If there's a predetermined amount of money that these organizations will get paid for certain treatments, they are going to order more of those treatments. I think that single payer would be a serious mistake. Let the insurance companies compete. That way they can lower their premiums if they can do it more efficiently. At the same time, a single payer program disincentivizes the individual from working harder to put away some money to buy a better insurance plan. If there's only the one plan, they're going to get that coverage. People should be allowed to be able to buy the coverage that they can afford, and if they can't afford it, health care is not a right, it is a privilege.
Thank you, Congressman Sessions. There's a couple questions here I'd like to merge because they approach in a legal fashion the issue from 2 points of view. One is, where in the Constitution does it specifically and directly authorize the federal government to entitle, institute, or regulate health care for any citizen of the U.S., regardless of class? What I'd like to do is start with Ms. McGovern, go to Mr. Hollis, and then back to Congressman Sessions. The other part of that question is, should the markets regulate everything, or is there some aspect to our culture where there's a social contract involved? And the government of the people, by the people, for the people, to quote Abraham Lincoln, has an obligation to provide health care for its citizens. So it's really in two parts. One is with regard to the Constitution, and the other is the theoretical basis for health care provision for the citizens of the U.S.
I want to thank the person that wrote that question, obviously, are the two questions. They're really interesting and a very good and thoughtful question that's been put to us. The Supreme Court has recently answered the question with respect to the Affordable Care Act and has identified the Commerce Clause of the Constitution as specifically providing the authority to the United States government to pass the Affordable Care Act and to engage in, health care. Previously and historically, in 1965, the Medicare Act was passed, and there were probably challenges as to that too. But the answer has been decided by the Supreme Court of the United States, and so I don't think that we have to quibble about that anymore. We can, it's legal to do it. Now, the next question really goes to, I think, one of the earlier questions, and that is there a obligation on the part of the government, because we are a government of the people, by the people, and for the people, to engage in a social contract which includes provision of health care? I think that it does. I think that just as our government over the extended period of time has engaged in public education, the provision of public education, that's in the nature of a social contract. The idea being that our society as a whole benefits when everyone in the society has an opportunity to be educated. Our society as a whole benefits when we have a healthy population, when we have the opportunity to reduce our costs because we have preventive care available to us, and people do not have to wait till they're in a crisis to seek medical care. Most frequently, according to all the studies that I've read, that results in the people ending up in an emergency room at a hospital, which is significantly more expensive than any preventive care cost. I am happy to see that many of the drug stores have these little minute, we don't mean to be irreverent, but doc in a box. The idea being that if there are opportunities for these services available either through the physicians or nurse practitioners, the problem as a health matter can be caught at an earlier stage. I see that as a benefit for all of us, and I think that just like the social contract to provide public education to everyone is similarly supported by the decision that the Congress of the United States and the President, now supported by the Supreme Court, have made to provide health coverage for the people of this nation.
Thank you, Ms. Govern. Mr. Hollis.
I'm going to have to disagree here quite a bit with Ms. McGovern. The Supreme Court did not say it was constitutional. They said it was a tax. They rewrote the law through legislation from the bench and took a mandate and turned it into a tax. That is not constitutional. That is judicial activism. The Commerce Clause, what it says is that the federal government has the right to regulate interstate commerce. Healthcare, by definition, by legal definition, is not interstate commerce. You cannot buy healthcare or health insurance across state lines. It is not allowed. Therefore, it is not part of the Commerce Clause. Therefore, it is unconstitutional. Now, you may make a case that at a state level there may be some social contract there, but the Constitution was designed to unify individual states under a common federal government but they were still responsible within the states to create their education systems if they wanted them, to create their healthcare systems if they wanted them. It is not a federal government responsibility by any means at all. The problem is we have trampled over our Constitution time and time again for over a century now, that we now have this mentality, this idea in our heads that these things are social contracts, that somehow we're entitled to these things, when it's destroying our nation. It's destroying our Constitution. It's destroying the things that used to unify us, and it's causing us to be divided. Now, I do believe there are things states can do to provide health benefits, emergency services to people who really need them, through setting up a network of volunteerism and donations to allow people who are in need to have that. But it needs to be, like I said, a voluntary kind of organization. Anything else is force. Government is force. Anytime you tell the government to do something for you, they have to force everyone else to participate. That is not freedom. That is force. That is taking away our rights. That I would quote, what I would quote is the Declaration of Independence. It says all men are created equal. That does not mean we all get the same stuff. That means that I have certain rights that you cannot take from me without my permission. It means you cannot rule over me without my permission. That is what it means when it says that we are equal.
Thank you, Mr. Hollis. I have one last question. Yeah, I'm sorry.
Excuse me, before you go on, I do need to acknowledge the point that Mr. Hollister made, that is that the Supreme Court in its 5-4 decision did not base the affirmation of the Affordable Care Act on the Commerce Clause, but rather on the right of the government to impose a tax. And it dealt with this issue of the mandate. Was the mandate a tax or not? And that is an argument that's been going back and forth. I believe that as the matter develops over a period of years, that the minority opinion finding that the act was constitutional under the Commerce Clause will become the majority opinion. But certainly Mr. Hollister is correct that it was not based on the Commerce Clause.
And may I?
Congressman Sessions on this?
Certainly.
Thank you.
Congressman Sessions.
Okay, I have some disagreements with what was said by the two panelists. First of all, Article 1, Section 8, first clause of the Section 8 of the Article 1 of the Constitution states that the Congress does have the authority to collect monies to pay for anything for the general welfare. That's under the taxation clause. That seems to be what the Supreme Court has endorsed. Personally, aside from being Pete Sessions, I would also say that the Commerce Clause takes effect because there have been numbers of decisions in the past that say it's not if you are necessarily engaged in commerce, but if you have an effect on commerce, the Commerce Clause applies. So I think it is clearly constitutional. Now let me step back into the Pete Sessions mode, which is why health care at all, which I believe was the second part of the question. So speaking as Pete Sessions, I would say Charles Darwin got most things wrong, but on the issue of social Darwinism, he got it right. And on social Darwinism, it's not the government's job to look after the sick and the elderly. If we want to be a strong nation, we have to winnow out those who are holding us back. It's not the position of the United States government to try and keep people alive longer than their natural period of time. Social Darwinism says that health care should be to those who can afford it and not provided by the United States government. That's my Pete Sessions take.
Thank you, Congressman. I have one here that's more of a statement, but I'll see if I can boil it down to a question. There are 10 other developed countries, namely Japan, Thailand, Sweden, Canada, Germany, Netherlands, Great Britain, that have excellent healthcare systems for all their populations. They also provide excellent healthcare, and the outcome of the healthcare is also excellent in terms of the dollars or the resources that are saved, and also in terms of the outcome for the citizens. The question is, and let me start with Ms. McGovern and then go to Mr. Hollis and then to Congressman Sessions. Why cannot Congress learn from these other successes?
Obviously, that's a rhetorical question, given what we have seen from our Congress in the last 4 years particularly. Congress could learn, but Congress has been engaged in a battle of wills, in my judgment, a dysfunction, which is what caused me to decide to run in the first place. We as a nation have had, beginning January 20th, 2004, the leaders of the Republican Party determined that they would make the president a one-term president. That was never their role. That's not their job. At that time, we were losing 700,000 jobs a month. We were losing, banks were collapsing, our financial situation was very dire. People were losing their houses. When we want to talk about what Congress could learn from other countries, what they could learn, I believe, is to pay attention to the job of representing the interest of the people of this country. If they are doing that, then they will look to other countries and the benefits from the single-payer system that has been provided in other countries, which has proven out to be less expensive for the government, and most of the citizens that are receiving those single-payer, the medical services under single-payer, are satisfied with that service. But until our Congress is changed, until a decision is made by the voters of this district to let Pete Sessions retire, we can expect that we will not learn from any other country, and indeed we will continue to have a Congress which is based on obstruction versus a thoughtful consideration of what the interest of the people are.
Thank you. Ms. McGovern. Mr. Hollis.
Well, I would say, first of all, they're not successes. You have people coming down here from Canada all the time to get medical care because they're on a waiting list up in Canada to get it. Same thing's true with England. Many of these other socialized countries. Now, some of them, yeah, they have figured some things out and they have gotten some things to work. But overall, I think that we still have the best health care here in America. We have the best technology. We have the best trained doctors. The problem, again, is not the health care. It is the health insurance. It is the way that our government and our health insurance is getting in the way and making it cost way too much money. Now, the other side of that, I lost my train of thought.
The response of Congress.
The response of Congress, that's right. The problem with Congress is that they're paid for by corporations. Their political campaigns, their donations that they get, they're playing to the people who are paying for their reelection, to paying for their campaign money. That's the problem with Congress. I'm not getting any of that. My campaign fund is coming from people in Texas. I'm going to be beholden to the people of Texas. I'm not going to be beholden to some corporation or some special interest group because I'm not getting money from them, and I don't want money from them. I want money from the people of Texas to help me represent the people of Texas. Thank you.
Thank you, Mr. Holmes. Congressman Sessions. Why has our Congress not been able to learn from others' successes?
Well, the first thing I would say, speaking as Pete Sessions, the nations that you're talking about there have some of the highest taxes in the world. Despite all studies that show that the people that live there seem to have greater happiness than we have here in the United States, despite that, we cannot afford to raise any more taxes. And to have the type of system they've got would bankrupt the American people. And my last comment about that is this is America. We do not have American policy dictated to us by European countries.
Were created as pay-as-you-go systems. Today's contributors, through payroll taxes, pay for today's receipts. Could you speak to this earned benefits concept? The idea that you are, through your work life, you have paid for the Social Security, and you are currently also paying for Medicare. Does this seem reasonable?
Starting with me?
Congressman Sessions, why don't we begin with you?
Well, as you know, I don't support the Social Security system at all, and I think that individuals should take responsibility for their own retirement. But in fairness, I would have to say Social Security is really not much more different than an insurance policy. You pay in a premium, and you are buying a benefit. If you live a lot longer, you might be paying in a lot longer. Eventually it stops when you reach a certain age. If you die earlier or get sick earlier, the coverage, it's just like an insurance policy.
Thank you, Congressman. Ms. McGovern.
In one of my answers earlier, I had made reference to the fact that both in the case of Social Security and in Medicare, we are talking about contracts that the workers of America have entered into with the United States government. That is that through each pay period that they are in, whether it's weekly, biweekly, monthly, whatever, a certain percentage of their pay is contributed to Social Security, and a separate percentage is contributed to Medicare. The employer also pays a share of each of those, so that what we have in the end is, and I do agree with Congressman Sessions on this point, it's an insurance with premiums have been paid in. It has been set up with the belief that when you become eligible for either Social Security or Medicare, that you will have paid a sufficient amount in to pay for the benefits you receive. The Social Security system was never intended to be a full retirement system. It's a safety net so that all people who have worked their 40 quarters and paid their contribution in do have some certain amount coming to them each month. There's a cost of living calculation that's done annually, which may increase the amount that is received. Medicare is a little bit different because what is happening is that the government, through the beneficiary, is paying insurance companies for the cost of the medical services provided. And that is the crux of the matter, because for some period of time there has not been the necessary restraints or cost-benefit analysis for the amount of money that is being paid for services. And the red flag has come.
Thank you, Ms. McGovern. Mr. Hollis.
You should look into something called demographic winter. If it wasn't for immigration into this country over the last few decades, Social Security and Medicare would already be causing bankruptcy, our country to be bankrupt. Because the people who live here are not having enough kids to pay for these things on a pay-as-you-go system. Now, Social Security has been basically stolen from by Congress over the years to pay for other things. In fact, during the Clinton year when they had a balanced budget, it was because they were taking money from Social Security. If they if they had kept that money in Social Security, they would have had a deficit in the budget for those years during the Clinton years. A pay-as-you-go system is the very definition of a Ponzi scheme. I know Governor Perry got a lot of flack for that, but I think he was correct. It is a Ponzi scheme. It wasn't designed to work the way we're trying to use it today, and it's not going to work. As populations continue to shrink, it is definitely not going to work. The only way these things work is if we continue to exponentially grow the population so that we have many more children than we have retirees. And that's simply not the case. That simply that's not sustainable.
Thank you, Mr. Hollis. I'd like to thank all of the candidates that have been here this evening, sharing their thoughts with us, answering the questions we have. Candidate Seth Hollis, candidate Catherine McGovern. So to give them an appreciative response. And in the absence of Congressman Pete Sessions, Bob Franklin. Very much appreciate his being here.
And personal statement, most of what I said I do not agree with.
Okay.
Thank you.
If you want to take a break, there's drinks.